Well, Jeffrey, the reality is if you're uninsured and you've got a pre-existing condition, you're over 50 or you're a woman, you go on and you're going to be rated by 2 to 1, 3 to 1, 4 to 1, 5 to 1, 10 to 1 in the insurance market. If you're healthy and you're 25 and you're a male and you got no problem, you can get insurance. I want to ask you about insurance. Jeffrey, you said you shouldn't cover autism. Well, okay, don't cover autism. Who needs to cover autism? Unless you're a parent with
I don't need autism.
You don't need it, but you need prenatal care or cancer or gout. I ruptured my Achilles tendon. Should that be covered? I think that we've made a mistake here. A society that we live in should listen to what Hubert Humphrey said. The mark of a successful society is what we do for those in the dawn of life, our children, the twilight of life, our elders, and the shadows of life, those with disabilities and the most vulnerable. And we do not do a very good job in this private market that those individuals have to access for the most part. We need to fix that system today. When I became the Access Director in 1987, we had about 250,000 uninsured in the state. We now have 1.4 million. When the Clintons proposed their health care plan, there were 30 million or so uninsured. We now have 45 to 50 million. How many of you out here are uninsured? Come on, there are a bunch of you out here. How many of you are underinsured? Just everybody raise your hand because you're underinsured. You are underinsured if you need long-term care service. Christopher Reeves, 1 second was Superman. The next second, he was a high-level cervical spine injury, quadriplegic on a ventilator. He had $1 million lifetime cap on his insurance policy. Many people do. And he went through that in how long a time? Under a year. And then he was uninsured and uninsurable. Fortunately for him, he had the ability to get coverage because he had access to other sources of funds. Let's just talk about where we're at. The access problem. We have 45 to 50 million uninsured in this country. Unacceptable. No other nation in the world does that. We have another 50 million or so who are definitely underinsured, and most of us are underinsured for other things. Pre-existing conditions, if you have a pre-existing condition, you leave your job, are you going to be able to get health insurance? Not very likely. Children. We have millions of children in this country who get no care. We have millions of women who are pregnant who get no prenatal care. And our numbers, when you look at us compared to the other 25 or so industrialized nations, are awful. You can use some of your numbers, Jeffrey, but the reality is when you talk about infant mortality, immunizations, life expectancy, and all those other criteria of what a great society does, it is shameful that this wealthiest nation in the world, in the history of the world, does this to the disadvantaged, does this to our minorities. Look around our society and see how our Hispanic community is doing in terms of its access to health care. It is abysmal, and government has to step in. We have seen what's happened with the Aetnas, Humanas, Cignas, United. They do a fine job for their stockholders. But do they do a fine job for the American politics, for the American public, for all of us who want to see a government and a society that is really worth what America should be, not what America has become? And therefore, we do need to reform our current dysfunctional healthcare system. But if I were to go down the line of government shouldn't be, what I should do then is take out my Medicare card and burn it. My Social Security card and burn it. My military retiree card, burn it. How about my library card and burn it? How about my pass to the public parks? Maybe Ken Burns was wrong. It wasn't America's best idea. What we should do is give it back to the private sector, have uranium mining, logging, and the cattle feeding on the edge of the park, and if you want to go visit it, you have to pay someone to get in, not the government, but that landowner. Is that a good idea, Tom? You like that? I think that there is a place for government in our society. There are places where government does a great job. Is it perfect? No. 45 years ago, I was in Vietnam. I can tell you government doesn't do a perfect job. But I did my training in medical school, history and physical, in a VA hospital. I did my internship at San Francisco General City and County. Did a lot of my training in the military, Harvard under a military scholarship, and down the School of Aerospace Medicine, military programs. I'm proud of spending 22 years in the Air Force. I'm proud of spending almost 7 years running the state access program, working for the governor of Arizona, trying to do the right thing for the people of Arizona, for those most disadvantaged. And I think that's what we should be doing. We should be becoming a great society, not an evil society. Thank you very much.